Welcome to Pharmacy Calculations, and for the next few minutes we will be looking at calculation of doses. I am Dwight Baker, and I would like to also extend my sincere gratitude to Nikenya Price for, of course, contributing some of the content. During previous sessions, we looked at what is a prescription, who are the persons legally allowed to write a prescription, the difference between dose and a dosage form. We also looked at what a dose frequency is and how that compares to the duration of therapy. What are the parts of a prescription and the different types of prescriptions? And we also looked at what are the parts of the prescription label and also some common abbreviations and symbols that are used in prescription writing. Throughout this recording, we will focus on calculation of doses, and there are some things that, of course, we will need to take note of. So, defining the term dose, calculate a dose based on the following parameters: adult dose, the age, weight, and body surface area considerations, calculating dose based on the body weight, and calculating dose based on the body surface area. You should also be able to identify different expressions relating to the dose, expressions such as single dose, daily dose, dose frequency, dosing regimen, duration of therapy. And also, you should be able to solve application problems involving dose calculations using parameters such as the age of the patient body weight, the body surface area, and of course there are some equations that you will need to aid you in those calculations, such as the Metzler equation for calculating body surface area, and also Gihan and George if it is that you're more imperially inclined, and nomograms, of course, using these with 100% accuracy and without assistance. Additional information on dosing calculations can be reviewed from the text answers and Stockloser 2010 or the 13th edition, reviewing chapters 7 and 8. So we'll start with the definition. What is a dose? And here I have projected a prescribed amount of drug that is needed to produce an intended medicinal effect. This definition is quite general. We can take the discussion, of course, a little deeper. Now, individuals are different. We do not always respond to the same or recommended dose of a drug in the same way. And so there are some things that we could consider. Now, let's look at acetaminophen, say 15 milligram per kilogram per day. Now, one could start thinking about this dose in terms of individuality. Now, this is a recommended dose of acetaminophen, but in terms of individuality, what specific group are we looking at here in terms of this recommended dose? And then some persons might say, okay, this may be the recommended dose for acetaminophen for a child. So in that case, it would be acceptable to give a child, say 10 to 15 milligrams of acetaminophen per kilogram per day. Now, when you look in terms of, say, acetaminophen 650 milligrams per dose, now, what does that mean with regards to the definition? Again, you could look at this again in terms of individuality. So for an adult, 650 milligrams of acetaminophen may be considered adequate for that adult to cause a reduction in pain or fever, which is the therapeutic indication for acetaminophen. Now, Ansel and Staclosa 2010 look at dose in a more in-depth sense. So the dose of a drug refers to the specific quantity or amount of medication administered to an individual within a particular time frame. And this, when you look in terms of the dose, there it is quantized, and it also has units. So in terms of those units, it's expressed in either milligrams or micrograms or grams, percentage, or any other quantized forms of measurement that may be associated with that specific drug. Now, when someone takes a drug, the person is taking that drug to receive some benefit from the drug itself. It could be that they're taking the drug to manage a disease condition or to prevent the occurrence of diseases. Now, there is something that is known as the threshold dose. Now, this is the minimum amount of the drug that is needed to, of course, elicit a therapeutic response in the individual. So, regardless of how much of the drug the patient takes, if it is that that patient has not taken the minimum amount of drug that is needed to elicit a therapeutic response, the patient is not going to be getting a benefit from the drug. So depending on the amount of drug given, a dose response, of course, is going to be noted in the patient, and that you will see from this dose response curve that is displayed here. Now, as the dose increases, the therapeutic response, of course, is going to be increasing. But this response will not be noted in the patient until the threshold point is reached, or the minimum point or minimum concentration of the drug. Now, that we discussed earlier as the threshold dose for the drug. The curve will rise. This is not always linear until it reaches what is known as the maximum therapeutic point or maximum therapeutic concentration for the specific drug. And at this point, the curve, of course, will plateau. Now, at this point, where the curve, of course, plateaus, there is no additional therapeutic benefit from the drug. This is known as the maximum therapeutic point or maximum therapeutic concentration. Additional doses of the drug will not cause the curve to rise any further in terms of that dose response. And what will start happening here is that the patient will start experiencing serious events or adverse drug events or experience fatal outcomes due to toxicities associated with the drug being taken. There are various factors that can influence the doses that are calculated for patients. Some things to consider: you look at things such as the height of the patient, the weight of the patient, and these two are very critical, especially when we're doing calculations for BSA or body surface area, and using that information, of course, in our dose calculation. You also want to look at the health status of the patient. So is this patient someone with a perfectly functioning kidney, or is this someone who has renal failure, or if it is that they do have renal failure, what is the stage of renal failure that this patient is at? Look also at liver function. So is this person someone who is experiencing liver failure, or what exactly is the health or disease state of this person? If you look also in terms of the disease itself, you could also look at disease severity, and these can influence the calculation of doses. So if you're looking, say, for at an infection, am I going to be treating this person with the dose of antibiotic for severe infection versus doing a dose for mild infection? And another thing that you can consider is the age of the patient. So is this a young child, or am I looking at someone who is advanced in age? Now, when you look at these extremes in age, the way that the body processes drugs are completely different. For an elderly, they may be more sensitive to some medications based on their enzyme reserves compared to the sensitivity that you may see within the regular adult population. When you look in terms of a child, certain enzyme systems may not be well developed to process certain drugs, and in that case, you will have, of course, a complete or totally different response for that specific age group. And so we must be mindful of these factors when we are calculating doses for these specific age groups. Now, when you think about the dose of a drug or the form in which it is presented to you, there are also some things that you must be mindful of. The form that the drug is given in, what you're seeing is not really the drug in its purest state. For example, in a capsule or a tablet, the active ingredient may be mixed with pharmaceutical excipients. So you have the active drug, which is that ingredient in the dosage form that is going to be resulting or eliciting the therapeutic effect, while you will also have other inactive ingredients. For example, in the tablet or the capsule, you may have things such as lactose, starch, or magnesium stearate, and these have different functions in terms of allowing the dosage form to function how it is supposed to function, but do not have any therapeutic properties. For your liquid, you may have things such as sweeteners, preservatives, or flavorants, along with the active pharmaceutical ingredients. In your injections, you may find things such as your water for injection or any other suitable sterile diluent that may be added to the preparation to ensure that you can actually inject that liquid safely. In your ointments or cream, you may have things such as a cream base or an ointment base, which may be hydrocarbon base or something such as wool fat or any other suitable base that can be used topically for those preparations. Now, when you look in terms of the dose as well and the dosage form itself, the route of administration, of course, is going to be different based on the drug, the dose, and the dosage form that you're looking at. So a capsule or a tablet, of course, those are designed to be taken orally. Your liquid may be taken orally. And then for an injection, of course, just as the name suggests, it's going to be injected. And then when you look in terms of the route of administration pertaining to an injection, there are various forms. So you can inject something subcutaneously or under the skin, intradermally as well. You can also inject something intrathecally, intravenously or IV, which is what most persons may be accustomed to. Can also inject intramuscularly, and the list goes on and on. And then for your ointment or creams, those are usually applied topically, so either to the skin or mucous membranes. Now, another thing that we will look at is what is a drug regimen. And the drug regimen is really how much of the drug the patient will be getting and how long the patient is going to be taking this drug for. So in terms of your prescription, you want to think about how much drug you're going to be dispensing to the patient. But what information is it that you use to arrive at how much you're going to be dispensing? So you have your prescription here on the left. It says RX metformin tab 750 milligrams. What does this mean? So here what you're seeing is the drug name, which is a metformin. You're also seeing a dosage form. It says tab, which is tablet, and then the strength of the medication, which is 750 milligrams. So what is a patient supposed to be getting? Metformin tablets, 750 milligrams. So that's drug name, dosage form, and strength. Other information that is critical for the drug regimen itself is the instructions to the patient. And in terms of this specific prescription here, again on the left, what you're looking at here, it says 1 tab TID. And we looked at those abbreviations in the previous content. So you can go back, of course, and review what these abbreviations mean. Now, in terms of the dose itself, it says 1 tab. So that would be 750 milligrams because that is what we established the strength of the medication to be in the previous line, 750. So 1 tab meaning 750 milligrams per dose. In terms of the frequency, we're looking at that here. It says TID, and that would be 3 times per day. What is the duration? Duration here would be the length of time that the patient is supposed to be taking the medication for. And based on the METE on this prescription, it says 2 months or 2/12. So that would be the duration of therapy. Using the same prescription from before, let us look at some of the concepts relating to the drug regimen itself. What is a single dose? Again, your prescription is available on the right this time. Metformin tab 750 milligrams, Sig 1 tab TID, METE 2/12. Now, in terms of the single dose, we'll look at that as your 1 tablet, and that would be 750 milligrams based on this prescription that is displayed here on the right. What is the daily dose? And this, in terms of determining what the daily dose is for the prescription, of course, you're going to look at the single dose and multiply that by the frequency at which a medication is taken. Now, with regards to the prescription, there are 2 times that are given on the prescription. That's the duration of therapy and the frequency. You must know the difference between the two. If it is that you're still not so sure, of course, you can go back and review all of that information on interpreting the prescription that was covered earlier. So in terms of the daily dose, that would be 750 milligrams times 3, and that would give you the 2250 milligrams. What is the dosing frequency? Again, that would be the TID that is in this prescription, and that is 3 times per day. What is the duration of therapy? So how long is the patient supposed to be taking the medication for? The patient is to be taking the metformin for 2 months. What is the total amount of medication that will be supplied to the patient for a specified period of time? And in this case, the information that is critical to help you calculate that quantity is the dose that the patient is getting, the frequency at which a patient is getting the dose, and the duration of the therapy. And in this case, that would be the 750 milligrams or 1 tablet multiplied by 3 multiplied by the duration of 2 months, which is equal to 180 tablets. Now, let's take a look at this example. So you have here Champix or varenicline tartrate. And for this tablet, we have a prescription here that says varenicline tartrate 1 milligram BID POPC times 4/52. Now, what is a single dose in this case? For all of these questions, you can pause the recording and then come up with your answer and then compare. Again, using the same example of varenicline tartrate or Champix, what is the daily dose? Now, next question, what is the duration of therapy? And recall, for duration of therapy, it's how long the patient is supposed to be taking the medication. If you came up with a duration of 4 weeks or 28 consecutive days, then indeed you would have been correct. Now, is the duration of therapy different from the frequency of dosing? What do you think? All right, so these are two different concepts. So the frequency speaks to how often the patient is going to be taking the drug within a 24-hour period, while the duration speaks to how long the patient is supposed to be taking the drug for. Now, what's the total amount of drug to be dispensed if varenicline 1 milligram tablets were available? Using the prescription that is displayed here, varenicline titrate 1 milligram BID POPC times 4 weeks. So the total dose is 2 milligram to be given over 28 days or 4 weeks. So 1 milligram 2 times per day, that's 2 milligrams. So remember, the things that you need to use to calculate how much or the quantity of medications to be dispensed is the dose, the frequency, and the duration of therapy. Now, since one tablet contains 1 milligram, then of course, for one day, the patient is going to be taking 2 tablets. Patient then takes 2 tablets times 28 days, so the total here is going to be 56 tablets for the 4 weeks. Now, let's say hypothetically you had varenicline tartrate 2 milligram tablets in your pharmacy. These tablets are scored, and you have this prescription for 1 milligram BID POPC for 4 weeks. How many tablets would you dispense in this case? Now, the tablet contains more than the required dose amount, so of course you're going to be halving the tablet in this case. Since the tablets are squared, the patient of course would be taking half 2 times daily, so that would be 1 tablet per day. 1 tablet daily times the 28 days, which is the duration of the prescription, would lead you to 28 tablets. This is part 1 of a 2-part recording. In the second portion of this recording, we will explore how to calculate dose based on patient-specific parameters.